If you're thinking about moving to France or just curious about healthcare here, dental care is probably something that you've wondered about. In fact, in just the past few weeks, I've gotten several questions from viewers asking me about dentists in France. They ask things like, how long does it take to get an appointment? Is it expensive? What is the quality of the care like? I'll answer all of these questions today based on my actual experiences. Since it had been a very long time since my last bilan or checkup and my last détartrage or cleaning, I thought it would be a good idea for me to actually schedule an appointment and then report back to all of you on how it went. I'm Susie, I'm American, and I've lived here in Dijon, France for almost 17 years now. And I've had my fair share of dental adventures along the way. But first, let me just walk you through the process of getting an appointment for a checkup and a cleaning here in Dijon. When I decided to try to make an appointment, my first reflex was to go to Doctolib, which is an online scheduling platform that many doctors and medical professionals use. But I scrolled through all the dental options here in Dijon, and none of the dentists took appointments on Doctolib. They're listed on Doctolib, but either it says that you can't make an appointment online, or there's a little note saying that they only treat patients that they've already seen. We used to have a family dentist at one point, but he's retired now, and I just haven't been to the dentist for ages. When I went back to film this shot of me scrolling through Doctolib, I saw that there were just a few appointments actually available online, but as you can see, they are for far into the future, July, August, and October, and it's April now, and there's not much choice in terms of times and dates. So on March 11th, I randomly selected a dental clinic in the area and I called to try to make an appointment. And instead of a human on the other end, it was an automated service, and everything was in French, and there were no other language options. And I did not have a referral or a prescription from my GP. That's not necessary in France. When you, the patient, decide that you need to go to see the dentist, you can just make an appointment and it will still be covered by the national healthcare system. The national healthcare system here is called La Sécurité Sociale, which can be a bit confusing for those of us who know Social Security as something else. But colloquially, many people just call it La Sécu. So the first prompt on the automated answering service was to press 1 for returning patients and to press 2 for new patients. And because I was a new patient, I obviously pressed 2, and then the automated messaging service said that the wait time for new patients was between 6 and 12 months, and that if I wanted to be on the wait list, that I should leave my name and phone number, which I did, and I hung up, and I figured I had a few months ahead of me to wait. And I should also mention that the automated messaging system said that if it was an emergency to hang up and dial 15, because 15 is the number for all medical emergencies in France. But just about 5 minutes later, a secretary called me back and offered me an appointment on April 7th. So this was on March 11th. So I managed to get an appointment for less than 1 month later. So my cleaning and my checkup were yesterday on April 7th. And just to give you a little more background, according to local statistics, the average wait time for a dental appointment in Dijon and the area around here is about 28 days, which pretty much matches my experience. France has about 71 dentists per 100,000 inhabitants, and there's about 59 dentists for every 100,000 inhabitants here in my department, the Côte d'Or. And Dijon actually just opened a new dental school in 2023, so maybe that will actually have a positive impact on access to care in the years to come. Apparently, the comparable stat is 60.4 dentists per 100,000 people in the US. Funnily, I noticed a concentration of dentists here in Dijon around Place Grangier. Maybe this is the informal dental neighborhood in Dijon, I'm not sure. Dental offices in France generally look very similar to what you're probably used to in the US, for example. Clean, modern, and with all of the equipment that you're probably used to seeing. When I first arrived in the dental office yesterday, they gave me a form to fill out where I had to answer a bunch of questions about my medical history when I was waiting in the waiting room. And then the dentist came and got me from the waiting room and took me into the exam room herself. And since I felt like I was on a fact-finding mission for all of you, I did take a photo of the form so that I could share it with you. Here it is. You can take a look. The appointment took about an hour. The dentist was really professional, but also really nice. She kind of chatted with me. We had a little small talk at the beginning. I think she was trying to put me at ease. She did a complete examination, including 2 types of x-rays, and then she did the cleaning. She did a really thorough job, and she wore a mask the entire time. Also, just something to note, it was actually the dentist who did the cleaning and not a dental hygienist. Since I was on a fact-finding mission, I asked a few questions. For example, I asked her how frequently she recommended that people get their teeth cleaned, and she said that the Sécurité Sociale covers 2 cleanings per year, and that she recommends that people come in at least once a year for a cleaning. And just for another point of reference, my husband's last cleaning was about a year ago, and he said that when he was there, the dentist told him that he could wait 2 years before coming in again for another cleaning. So it probably just depends on the dentist and on the patient as well. I also asked if, now that I was officially a patient, now that I had been treated at their center, if it would be easier for me and faster for me to get an appointment in the future for myself and for my kids. And they said yes. And in fact, as I was leaving, they asked me if I wanted to make an appointment for my kids as well. And I also asked if they spoke English, and the dentist I saw yesterday jokingly said, no, she did not speak English at all, but I bet she was underestimating her skills, and I imagine that her English is good enough to probably get by, but she did say that some of her other colleagues spoke English, so that is something to take into consideration when you're making an appointment as well. I was hoping that she would say that she did speak English and that I could then give her name to anyone who asked me for an English-speaking dentist in Dijon, but unfortunately I struck out there. But she was very nice, and if you want her name, you can contact me and I will let you know. Okay, now let's talk about money because I bet that's what many of you are curious about. How much did I pay for my checkup and my cleaning yesterday? Well, I paid nothing out of pocket. Zero. I was actually pretty surprised as well. I thought that I would have to pay out of pocket and that I would then get reimbursed, but that wasn't how it worked. I paid nothing. I assume if you were not covered by the French health system, then you would just pay out of pocket. But I am covered by the Sécu, which is going to pay for 60% of the visit yesterday. The base rate set by the Sécu for a cleaning is 28 euros and 92 cents, but the provider can decide to charge more, and these additional fees or surcharges are called un dépassement d'honoraires. At the dental center that I went to yesterday, they had a list of the prices for the different services that they charge hanging in the lobby in the waiting room, and it said that the base price that they charge is 28 euros and 92 cents for a cleaning, so they do not charge a dépassement d'honoraires for a cleaning. When you go to the doctor, the dentist, any medical provider, the pharmacy, for example, in France, they ask you for your carte vitale. Here's mine. I've had it since 2009, so you can see my baby face. And they put the card with this little chip, they put it into one of those payment terminals. So the little chip communicates to the Sécu that you have been to the doctor or the dentist, for example, because normally the way it works is that you pay out of pocket for the care that you have received. And then this little chip communicates to the Sécu that you've been to the doctor or the dentist, and therefore the reimbursement process is started. So usually if you pay out of pocket for a doctor's visit, for example, you get reimbursed within a week or so. And for a doctor's visit, the Sécu reimburses 70%, I think, of an adult visit to the doctor, whereas for the dentist, it's 60%, for example, of a basic cleaning. So to cover what's not paid for by the Sécu, what's not reimbursed by the Sécu, most people in France have what's called a mutuelle, which is a complementary private health insurance coverage. So I have one through my husband's job, in fact, which covers our entire family. And it covers, for example, the remaining 30% of doctor's visits, the remaining 40% of dental visits. And if there are dépassements d'honoraires, some mutuelle will cover that as well. It just depends on the plan that you have. We're actually really lucky because the mutuelle that we have is very comprehensive. So it not only does it cover dépassement d'honoraires, but it has also covered things like, for example, my glasses. So normally, again, the Sécu will pay for a small portion. Your mutuelle will pay for some remaining part of the glasses as well. But ours is very generous. And so I never wind up having to pay anything out of pocket for my glasses. And another example is that both of my kids have braces right now, so we are at the orthodontist all the time, and you can imagine the bills that I was afraid we would incur as a result. But luckily, our mutuelle covers all of the orthodontics that our kids are receiving right now, so that's a giant relief, of course, for our family and our family's budget as well. Yesterday, the care that I got was pretty basic, so a checkup, some x-rays, and a cleaning, which wasn't very expensive anyway, and luckily was completely covered. But even for more complex procedures, for example, a crown, I have a crown here. I don't know if you can see. It's still quite expensive. The care costs a lot, but it depends. And again, it will depend on your mutuelle, how much is covered. But I remember when the dentist told me that I was going to need a crown, I was really worried about the cost. I think that that's just always my default, is that I'm worried how, immediately I wonder how much things are going to cost. And same thing for my crown. It was completely covered by a combination of the Sécu and our mutuelle. So I was really surprised yesterday when I didn't have to pay for anything out of pocket. I was a new patient, so I didn't really know how it worked in that particular dental center. Um, but it has been a long time since I went to the dentist, so maybe this is more common than I'm aware of. So in fact, when the woman at the front desk told me at the end of my appointment when I was leaving that I had nothing to pay for, I was really surprised. And she said, "Oui, madame, on pratique le tiers payant," which means that they have a third party payer system, which means that they request reimbursement directly from the Sécu and the mutuelle. So you don't have to pay out of pocket and then wait for reimbursement as the patient, which is really convenient and really great, and maybe makes dental care, for example, even more accessible to people who maybe don't necessarily have the resources to pay out of pocket, or for whom it might be more difficult to pay out of pocket and have to wait to be reimbursed after the fact. So, yeah, I was really pleasantly surprised. So the bad news is I'm going to have to go back several times, in fact, because the dentist found a couple cavities, which is kind of embarrassing to admit for some reason. And she also recommended that I have one wisdom tooth, and she said that it's on the verge of starting to cause some issues, and she recommended that I get it removed. So I'm going to be going back to the dentist several times in the next few months. And if you're interested, I can report back on how it goes, and if I wind up having to pay for anything out of pocket and how much all of that care is going to cost me. Let me know in the comments below if you if you want to follow along, and I will make an update video as well once all of this once all of these treatments are over and done with. I also looked around online to see how much a checkup and a cleaning and x-rays would cost in the US, but there are just so many factors, it's really hard to figure out. So let me know in the comments below how much a cleaning costs for you. I guess it depends on where you are, whether or not you have insurance, etc. I know there's so many factors, but it might be interesting to have a few points of comparison in the comments below. And of course, I know that this system is not free, and I do help. I participate in financing it because I am working here in France, and I see every month when I get my payslip that there are payroll deductions that go towards my part in financing this system. So there's one that's very blatantly, obviously meant to be paying for the healthcare coverage, and then there's another tax that we pay, and that our employers pay as well. That also goes to help to finance the national healthcare system as well. But that it doesn't just end there. I couldn't just go through and calculate these amounts and say, okay, this is my personal contribution to the national healthcare system, because our rental income is also taxed, and part of the tax on the rental income also goes to financing the national healthcare system as well. So the calculation is a bit complex, but what we get as a result of this, the coverage that we have access to, really is high quality, and especially maybe because we live in Dijon, which is a small city, so we have relatively quick and easy access to really high quality care. There's also the mutuelle that my husband gets through his work as well. So his employer pays for part of it, and then he pays as well through another payroll deduction of 47 euros a month, which covers the remainder of any of the healthcare expenses that we have as a family. And like I said, it's a very comprehensive plan, and we are very lucky to have access to that as well. So there you have it, dental care in France. To summarize, access to care may take a while in certain areas, but is generally relatively affordable, and I would say usually very high quality. So thank you so much for watching, and thank you to the viewers who asked me the questions about the dentist, because without you I probably wouldn't have bothered to make an appointment and to get my dental issues taken care of. So it's really good news. Thank you. I do have some other sort of health maintenance issues that I've been putting off, and I'm wondering now if I should just go ahead and try to make those appointments. For example, I know I need to go to the dermatologist. It's been a while. And I thought maybe if you're interested, you could let me know in the comments below, and I would be happy to make another video and sort of report back on my medical adventures, if you will. In any case, thank you so much for watching, and I'll link here to another playlist that includes more videos about my life in France. If you're interested, you can check those out as well. Thank you so much for watching, and until the next time, à bientôt!